Sexually transmitted diseases, do they really exist? What are the causes? What are they actually? How can we prevent them? What are my chances of getting them? Are they curable? All these questions today I am going to answer. I, Dr. Sudeshna Ray, today I'm going to answer all these common questions about sexually transmitted infections, that is STIs, or sexually transmitted diseases, which is STD. So what is the difference between a sexually transmitted infection and a sexually transmitted disease? Well, an infection is just an infection when you get it. But if you ignore the infection, it takes a form of disease, that is a chronicity of the infection. So a sexually STI is an infection which can be easily treated, whereas STD becomes a sort of a disease which might be a little difficult to treat. Sexually transmitted infections or diseases are a reality. About 6% of the adult population in India will have one or more STIs, which makes about 30 to 35 million episodes of STIs per year in India. After just one episode of sex with an infected partner, the chances of getting an STI for a female is as high as 60 to 90%, whereas the chances of a male getting infected by a female partner is only 20%. What are sexually transmitted infections? Well, these are infections which are transmitted from an infected person through sexual contacts or through sexual fluids like the vaginal fluid or semen, and sometimes even through saliva. Most of the time, sexually transmitted infections are transmitted through the sexual contact. Sometimes a skin contact can also transmit infections, example herpes and warts. What are the causes of sexually transmitted infections? They can be caused by bacteria or virus or even parasites. Examples, like the common examples like gonorrhea, syphilis, chlamydia, human papillomavirus, hepatitis B and HIV. These are the common sexually transmitted infections. How serious are STIs? Well, they are the commonest form of contagious diseases or transmissible diseases. They can be serious illnesses which needs treatment. Some of them, like HIV, cannot be cured and can really be deadly. Some of them, like chlamydia, they can be silent killers of the reproductive system as far as future fertility is concerned. Some of them, like HPV, like human papillomavirus, can lead to serious problems like cervical cancer. When does one have a higher risk of having STI? If one has more than one sexual partner. If she has sex with a partner who has multiple sexual partners or who has had multiple sexual partners. If she has sex with a partner who has an STI. If she herself has an STI, she is more prone to having other STIs. Or if one is using intravenous drugs or the drugs which is injected into the vein, or she has sex with a partner who has IV drugs. Can adolescents have STIs? Yes, adolescents can have STIs. In fact, the risk of STI is more in adolescents. I'll tell you why. One, there is a certain immaturity in the reproductive organs which makes them less powerful to fight these bugs out. 2, they are not aware of the causes and the consequences. 3, they seek late treatment for a symptom because they are scared to talk to their parents. They do not have the money to pay the specialist to whom they would go to, and they are very inhibited to go to their known doctors to seek treatment for this. So what are the symptoms of an STI? Well, the symptoms can be varied. They can vary from a very mild vaginal discharge to a large amount of vaginal discharge. There can be a small pimple to a large ulcer. There can be a very mild pain to an acute pain in that area. In fact, a lot of these infections, the symptoms actually occur when the infection has been going on for quite some time. So the key is to have a suspicion of an STI and seek treatment as early as possible. How can I prevent sexually transmitted infections? 1. Avoid multiple sexual partners. 2. Avoid sex before the age of 20. 3. Know your sexual partners well. 4. Always insist on latex or polyurethane condoms while having sex. 5. Know that some sexual practices can increase the risk of STI, for example, anal sex. And 6. Get vaccinated. Get vaccinated against certain STIs like human papillomavirus disease or HPV disease and hepatitis B. Please remember, prevention is the key solution for STIs. However, if you have missed the bus of prevention, at least seek earliest medical help when you have a symptom or even when you are having a suspicion that you might have an STI.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.